It's 11:47 at night. Marcus and Elena Garcia are sitting at their kitchen table not talking, just staring. Between them, a laptop screen showing a credit score of 589 and a stack of envelopes, medical bills, collection notices, explanation of benefit statements they've read so many times the paper's starting to wrinkle at the edges. 6 months ago, that number on the screen was 749. They own a home. They have 2 kids. Marcus works in logistics. Elena teaches 4th grade. Together, they bring in just under $96,000 a year. They had insurance. They did everything right, and none of it mattered. My name is Sage. I spent over a decade inside the financial system as a Series 7 licensed advisor and as a consumer lender, and I watched situations exactly like Marcus and Elena's walk through the door more times than I can count. Good people, responsible people, people who played by every rule they were ever taught, destroyed by a system that was never designed to protect them. Today we are talking about something that the number one concern of Americans right now, and it is not gas prices. It is not inflation. It is the cost of health care. And more specifically, what happens to your finances, your credit, and your future when that system fails the people who need it most. The middle class. Stay with me to the end of this video because I am going to give you 5 specific hidden gems that could protect your credit score, save you thousands of dollars, and give you a fighting chance against a system that is counting on you not knowing any of this. If this is your first time here, welcome. Hit that subscribe button right now because every single week we expose the financial systems keeping everyday people broke, and we give you the real tools to fight back. Let's get into it. Marcus started feeling off in January. Chest tightness, fatigue. Nothing dramatic, just enough to worry Elena. So he did exactly what you're supposed to do. He called his primary care physician, got an appointment, described his symptoms. His doctor ran an EKG, ordered blood work, and referred him to a cardiologist. Marcus checked the cardiologist against his insurance company's website and network. He was being responsible. He showed up to every appointment. He followed every instruction. What nobody told Marcus, what the insurance company's website does not show you, is that the diagnostic imaging center his cardiologist sent him to for a cardiac stress test was out of network. Same building, different billing entity, completely out of network. That one test that Marcus had no idea was out of network cost his family $2,200 out of pocket instead of the $400 copay they expected. And here is where the real trap lives. Hidden gem number 1, and I want you to write this down. The average employer-sponsored family deductible in America right now is over $3,500. Many plans run $6,000, $7,000, even $8,000 before insurance begins paying significantly. But here is what most middle-class families do not understand. The deductible is not where the cost stops. After you clear your deductible, coinsurance kicks in. That means you are still paying 20 to 30% of every single bill that follows. And the out-of-pocket maximum, that number, that sounds like your safety net can legally reach $15,000 or more per family in a single year. I sat across from loan applicants for years, people with strong incomes, solid payment histories, good jobs, and the single most common reason their credit files were damaged was not overspending. It was medical debt they never saw coming from coverage they genuinely believed would protect them. The coverage illusion is real, and the middle class pays the highest price for it because they earn just enough to be disqualified from assistance and not enough to absorb what the system leaves behind. Marcus's cardiologist needed a clearer picture. He referred Marcus to a specialist for a follow-up cardiac procedure. The facility was in network. Marcus confirmed it. What he did not know, what almost nobody knows to check, is that the physician group performing the procedure inside that in-network facility billed completely separately. And that physician group was partially out of network. One procedure, 4 separate bills: the hospital, the physician, the anesthesiologist, the pathology lab, all arriving in different envelopes over the following 6 weeks. Elena missed 4 days of work during Marcus's recovery. Marcus missed 11. Their emergency fund, $4,800, was gone in 3 weeks. Hidden gem. Number 2. This one will shock you even if you think you already know it. Federal law, specifically, the No Surprises Act passed in 2022, was designed to protect patients from exactly this kind of out-of-network billing inside in-network facilities. But here is what the legislation did not fully solve. The law has exceptions. It has a dispute process most patients never use because they do not know it exists. Imbalanced billing in certain situations is still legally permitted. More importantly, and this is the statistic I need you to sit with for a moment, research published in the American Journal of Public Health found that roughly 2/3 of all personal bankruptcies in America are tied to healthcare emergencies. Not just the bills themselves, but the income lost when you are too sick or too injured to work. Both hit at the same time, exactly like they hit Marcus and Elena. That translates to an estimated 530,000 families filing for personal bankruptcy every single year in America because of medical costs or illness-related loss of income. 530,000 families every year in the wealthiest nation on earth. And here is the number that stopped me cold when I read it. Approximately 7.4% of Americans experience what researchers call catastrophic healthcare expenses in any given year. That is more than double the rate of any other developed nation on the planet. This is not a healthcare problem that other countries also struggle with. This is uniquely American. And the family sitting exactly in the middle of the income ladder, the family that makes too much for Medicaid and too little to absorb a $23,000 out-of-pocket surprise, is the family those statistics are built on. Before we go further, if this video is already opening your eyes, hit that like button right now. It takes 1 second and it helps us get this information in front of more people who need it. And if you are not subscribed yet, do that right now. We do this every week and you do not want to miss what's coming. 6 months after Marcus's procedures, the collection notices started arriving. Not because Marcus and Elena were ignoring the bills, they were trying to pay them. But $23,000 in unexpected medical expenses against a family with no emergency fund left and a mortgage payment due every month, the math simply did not work. One account went to collections. Their 749 credit score dropped to 589 in a single reporting cycle. 160 points. Gone. Now their mortgage refinance they had planned off the table. The home equity line they were considering for their daughter's college denied. The interest rate on their car loan renewal jumped significantly. Hidden gem number 3. And this is where my background inside lending gives you something most people never hear. Medical debt behaves differently on your credit report than almost any other type of debt, and most consumers have no idea. First, and write this down, there is a mandatory 365-day waiting period before a medical debt can legally appear on your credit report. 1 full year. That is not a grace period the hospital gives you out of kindness. That is a federal consumer protection built into the credit reporting rules specifically for medical debt. Most patients do not know this. They receive a collections notice and panic. They either pay immediately without negotiating or they freeze up entirely. Both responses leave money on the table. That 365-day window is your negotiation window. It is your dispute window. It is your financial breathing room. Use it. Second, as a former consumer lender, I can tell you that even before the recent rule changes, sophisticated lenders were already beginning to discount medical collections differently than credit card or loan defaults when evaluating applications. The industry understood that medical debt often reflects a life event, not a behavior pattern. That distinction matters when you are sitting across from an underwriter. Third, a single medical collection has historically been capable of dropping a strong credit score between 50 and 100 points overnight. The same catastrophic impact as a missed mortgage payment. From a bill the patient may have been actively trying to resolve. That is not an accident. That is the system working exactly as designed for everyone except you. Here is where I get to tell you something that even financially literate people who think they know how all of this works, do not know. The credit reporting rules around medical debt have changed significantly in recent years. And if you have medical debt on your credit report right now, some of it may no longer legally belong there. Hidden gem number 4. In 2023, the 3 major credit bureaus, Equifax, Experian, and TransUnion, made sweeping changes to how medical debt is reported. Number 1, medical debt collections under $500 were removed from credit reports entirely across all 3 bureaus. Number 2, paid medical collections were removed from credit reports entirely. Previously, even after you paid a medical collection, it could remain on your report for up to 7 years. That rule is gone. Number 3, the 1-year grace period before medical debt appears on your report was extended and reinforced as a standard across bureaus. Now here is where I have to be completely straight with you, because this is exactly the kind of thing nobody tells you, and it matters right now. The Consumer Financial Protection Bureau had been pushing to go even further, pursuing a rule that would have removed all medical debt from credit reports used in lending decisions entirely. That would have been a massive protection for middle-class families. That rule is currently being rolled back. A federal court granted permission to reverse those expanded protections in 2025, which means the fight over how medical debt is reported on your credit file is not over. It is actively being reversed in ways that affect you directly. This is why staying informed is not optional. The protections that exist today may not exist tomorrow, and the ones that were coming may never arrive. That is the reality of the system you are navigating. What you can act on right now, and this part is still fully in effect, is critically important. Now here is the action step inside this hidden gem, and this is critically important. Pull your credit reports right now from annualcreditreport.com. You are entitled to free reports from all 3 bureaus. Look specifically for any medical collections under $500, they should be gone. Look for any paid medical collections, they should be gone. If they are still appearing, that is a disputable error and you have the right to have it removed. I have seen people recover 40, 60, even 80 points on their credit score simply by identifying medical collections that should have been removed under the new rules and were not. Right here, take one moment. If you know someone who has dealt with medical bills, a family member, a co-worker, a friend, share this video with them right now. This information is genuinely life-changing for people who need it, and most of them will never find it on their own. Share it. And if you haven't subscribed yet, now is the moment. Everything we've covered so far is the problem clearly named. Now let's talk about the moves that actually protect you before a crisis and after one. Hidden gem number 5, 5 specific moves. Move number 1, the HSA. A health savings account is one of the most powerful and most underutilized financial tools available to the middle class. If you have a high deductible health plan, which most middle-class employer plans now qualify as, you are likely eligible for an HSA right now. Here's why it matters. HSA contributions are triple tax advantage. Your contributions go in pre-tax, they grow tax-free, and withdrawals for qualified medical expenses are tax-free. No other savings vehicle in the American financial system does all three. In 2026, you can contribute up to $4,300 individually or $8,550 for a family annually. Unused funds roll over every year. This is not a use it or lose it account. And after age 65, you can withdraw for any purpose without penalty. Start one. Fund it consistently. It is your financial buffer against exactly what happened to Marcus and Elena. Move number 2, negotiate every bill. Most patients do not know that medical bills are negotiable, almost universally. Hospitals and physician groups routinely accept significantly less than the billed amount, especially if you are uninsured or if the bill is creating financial hardship. Call the billing department. Ask specifically about their financial hardship program. Virtually every hospital, including for-profit systems, has one. Ask for a payment plan with zero interest. Ask what the cash pay discount is. Ask what the insurance negotiated rate would be, and request that rate even if you are paying out of pocket. These are not tricks. These are conversations the billing department has every day with people who know to ask. Move number 3, request the itemized bill. Never pay a medical bill from a summary statement. Always request a fully itemized bill, every line item, every charge, every code. Medical billing error rates are staggering. Studies have found errors in the majority of hospital bills reviewed. Duplicate charges, upcoded procedures, charges for services never rendered. These are common enough that reviewing your itemized bill should be automatic. You have the legal right to this document. Request it every single time. Move number 4, know the dispute process. If a medical collection is on your credit report that should not be there, whether because it is under $500, because it was paid, because it is outside the 365-day window, or because it is simply inaccurate, you have the right to dispute it directly with the credit bureau reporting it. File your dispute in writing. Cite the specific rule violation. The Bureau has 30 days to investigate and respond. If they cannot verify the debt meets current reporting standards, it must be removed. This is not a loophole. This is your legal right under the Fair Credit Reporting Act. Move number 5, make the one phone call most patients never make. Before you pay any significant medical bill, call the hospital's patient advocate or financial counselor. Not the billing department, the patient advocate. This is a role that exists specifically to help patients navigate financial hardship, identify assistance programs, connect patients with charity care, and in many cases significantly reduce or eliminate balances for qualifying patients. Middle-class families often assume they earn too much to qualify for any assistance. That assumption is frequently wrong. Income thresholds for hospital financial assistance programs are often higher than people expect, and many hospitals are legally required to offer them as a condition of their nonprofit tax status. One phone call. Most patients never make it. Marcus and Elena didn't lose their house, but it took 18 months. 3 formal credit disputes that removed collections that shouldn't have been there. 2 rounds of bill negotiation that cut their balance by nearly 40%. A payment plan. And knowledge. Knowledge most people in their position never get access to. The system was not designed to tell them any of what I just told you. The 365-day rule, the new credit reporting changes, the HSA, the itemized bill, the patient advocate. None of that is in the paperwork the hospital hands you on the way out the door. And that is exactly why we are here. If this video helped you, if it opened your eyes to something you didn't know, do 3 things right now. Like this video, subscribe to this channel, and share this with one person in your life who needs to hear it. One person. That's how this information reaches the people who need it most. The more you know, the more you grow. I'm Sage, and I'll see you in the next one. Next time we are talking about the one institution that every single American hands their money to and trusts completely. And we are going to talk about exactly what happens to that money the moment it leaves your hands, and why the people who can least afford to lose it are the ones the system is most designed to profit from. Every other developed nation handles this differently. We don't. In next video, you are going to understand exactly why. That one is coming up next.